Audio Jungle.
We have breaking news coming out of Washington, D.C. Following last night's heated presidential rally, Donald Trump was pushed down the stairs by Hillary Clinton, leading to the loss of his front tooth. Trump was rushed to the dentist following the incident and is expected to make a full recovery. Joining us tonight through our new high-tech video conferencing system, Zoom, Donald Trump and his dentist, Dr. Matthew Weiss. President Trump, can you please tell us about the events that took place last night?
Thanks, Peter Baklava. Great to be here. Great to be here. That crooked Hillary is such a nasty woman. She's trying to hide this story like her emails, but let me tell you something. I'm lucky to be living in this great, great country with great dentists. And this dentist right here, this is a great, great man. One of the best. So last night, crooked Hillary pushed me down the stairs, and I fell right on my tooth. The tooth went flying out, and I was so scared. How can I repeal Obamacare without my front tooth? But this man is unbelievable. My tooth is going to be all right.
So, Dr. Weiss, can you tell us, how were you able to restore his smile?
When a tooth falls out, we call it avulsion.
Trauma occurs dislodging the tooth from its socket. The patient may notice bleeding. The nerve and blood supply to the vital part of the tooth, or the pulp, is cut off. The fibers that hold the tooth in place, known as the periodontal ligament, are torn. This is what happened to President Trump after Hillary Clinton pushed him down the stairs.
When I got the call that the president had lost his tooth number 21, I told him to remain calm. One must find the tooth and pick it up by the crown. I told him to avoid touching the root. He was very good at it. He said the root looked so dirty, so I told him to wash it for 10 seconds under cold water and to try to gently put the tooth back into place. Unfortunately, he was unable to do so, so I told him to put it in some milk.
Milk is one of America's best products. I've had a lot of milk in my life. Believe me, the milk we have in America is some of the best in the world. Probably the best. I'm going to make sure all American milk companies get proper funding this year.
So, from what I understand, the tooth didn't go in, but what happened next?
The president couldn't find any milk. I told him to hurry to my office and to keep the tooth in his mouth, between the molars and the inside of his cheek. This is a very important step because you want the tooth to be exposed to air for as little as possible.
I had no idea the root of the tooth was so huge.
So, once President Trump arrived at the office, what happened next?
So we clean the root surface and apical foramen with a stream of saline, and then we soak the tooth in saline, removing any contamination and dead cells from the root surface. After that, we administered a little local anesthesia.
That little needle hurt like a bitch.
We irrigate the socket with saline, examine the alveolar socket. If there's a fracture of the socket wall, we reposition it, and we're careful with a very suitable instrument. We replant the tooth slowly with slight digital pressure. We don't like to use too much force. Then we suture gingival lacerations if any are present, and finally we'll verify normal position of the replanted tooth both clinically and radiographically. Here's a radiograph that we had taken of President Trump. What you're looking at is a periapical radiograph taken immediately after President Trump arrived.
That's so interesting, Dr. Weiss. President Trump, you are a very, very brave man.
Thank you, Peter Baklava. You know, there's fake news out there, but as leader of the free world, I know it's important to be very brave. Very, very brave.
So let's recap. I understand you put the tooth in between the molars and cheek to keep it moist since American milk wasn't available. Then you inserted the tooth back into its socket gently with a bit of anesthesia. I would be afraid of my tooth falling out again, to be honest with you. May I ask, was there anything more to the treatment?
We'll apply a flexible splint for up to 2 weeks, keep away from the gingiva. Then we'll administer systemic antibiotics. Usually we'll go for a tetracycline as a first-line choice, or a doxycycline 2 times per day for 7 days at appropriate doses for the patient's age and weight. The risk of discoloration of permanent teeth must be considered before systemic administration of tetracycline in young patients. If the avulsed tooth had been in contact with soil and we were worried about tetanus coverage, we would refer President Trump to a physician for a tetanus booster. The next step would be a root canal treatment 7 to 10 days after replantation and before splint removal.
Root canal treatment, why is that necessary in this case, doctor?
Great question, Peter.
Great question, Mr. Baklava.
The primary goal of rapid reimplantation is to preserve the PDL, not the tooth. The avulsed tooth inevitably requires a root canal. However, if the periodontal ligament survives, the degree and timeliness of root resorption is improved and ankylosis is decreased.
So, President Trump, how were those 7 days between seeing Dr. Weiss and needing a root canal?
Well, you know, the unbelievable doctor to my left, Dr. Matthew Weiss, great doctor, by the way, he told me to eat soft food for 1 week and to brush my teeth very softly. And you know what? It wasn't that bad.
Donald's going to want to use a chlorhexidine mouth rinse twice a day for a week, as well as avoid any contact sports.
So, doctor, are there any follow-up appointments?
You want to put your mask on?
That doesn't work.
That's fine with it.
Where's that?
We're going to do a clinical and radiographic follow-up with the president at 1 week, 6 months, and 1 year.
So, doctor, how much can we expect this to cost?
The ER visit is usually about $100. X-rays are...
It was a huge bill, a huge bill. But don't worry, Mexico's paying for it, and the wall.
Once you combine the X-rays, splints, root canal, all in all, it's going to come to about $1,100 or $1,200.
President Trump, Dr. Matthew Weiss, thank you for joining us tonight.
Sorry, before I go, just a few take-home messages about tooth avulsion for all our viewers out there. Typically, when everything works out like this, we should be seeing radiographical images that are sound within about 3 months. But it's important also to consider the other teeth that might also be traumatized. That's why we need a good medical history, a good history of the trauma, and oral and radiographic examination, which is especially crucial. If this does happen to you, it's important to try and put the tooth back into place. If it doesn't work, put in a cup of milk or saline. If you don't have any of these available, put it in your mouth between your cheek and your molars. And make sure to report it to your dentist as soon as you can.
Thank you for having me on tonight, Peter Baklava. And God bless America.
Okay, go.
What network is this? CNN?
Yeah.
This is Peter Baklava signing off for tonight. Thank you from all of us from CNN. For more information about how you can deal with tooth trauma or other dental-related incidents, please contact your local dentist, and hopefully he or she will provide amazing results, just like Dr. Weiss was able to provide President Donald J. Trump.
We know that was a lot of new information coming your way, so we're just going to run down the key points in treating tooth avulsion. So the first thing you want to tell your patients if they happen to lose their tooth is you need to pick up the tooth by the crown. You can tell them that's the white part of the tooth. They want to wash the root under cold water and attempt to put the tooth back into its socket if they can. If not, they can place their tooth in a cup of milk while they're waiting to bring it to the dentist. If they don't have milk, another option is to keep the tooth in between their back teeth and their cheek. The main thing is that you want to keep the tooth away from the air because this can lead to cellular damage. Once they arrive at your office, you need to calm the patient down, tell them it's going to be all right. You want to obtain a medical and dental history and a history of the trauma so you can get the full picture. You also want to keep in mind that other teeth may have been injured during the trauma. In treating the avulsion, the first thing you need to do is clean the tooth in saline, administer local anesthesia to the area, examine the bone socket, and you can clear it out if there's anything in the way. You can replant the tooth, but just using light pressure. You want to suture up any cuts or lacerations and verify the position of the tooth, just using your eyes, looking at the patient, and also radiographically. The next step in treatment is to apply a flexible splint, which is kind of like braces to the front of the teeth. And you want it to be flexible to encourage regrowth of the PDL as opposed to just bone formation. You give tetracycline antibiotics, and if the tooth was in contact with soil and you're unsure about the patient's vaccination history, you're going to want them to get a tetanus booster from their doctor. When you send the patient home, it's important to remind them to eat soft foods and maintain good oral hygiene using a soft toothbrush. They can also have a chlorhexidine rinse twice a day, and they want to avoid any contact sports. We'll follow up with the patient 1 week after the incident, 6 months after, and 1 year. The total cost, this can vary depending on where you are and which dentist you see, but approximately an ER visit will be about $100, x-rays $50, the replantation and splint around $250, root canal $600, and the follow-ups can be about $50 to $100. So the main take-home messages. The tooth area, the bone in the area, should be healed within 3 months and look radiographically sound. You need to consider that other teeth may have been chipped or damaged or knocked out when the patient experienced the trauma, and it's important to have a good medical history and history of trauma. You need to keep the tooth in milk or saline or in the saliva at the back of the mouth while coming to the dentist, and remind the patients to get to the dentist as soon as possible. This will increase the prognosis.